Hello, my name is Dr. Sandy Bevacqua, and welcome to Creating a New Revitalized You. This is the first of our fall video series called Understanding the Importance of Your Intestinal Health. Today's segment is Natural Solutions to a Strong Immune System Through Optimized Intestinal Health. So there's plenty of evidence that tells us that our immune systems are in trouble. We have all kinds of issues that are showing up in our population. We've got cancer, autoimmune disease, there's neuritis and asthma, allergies, persistent infections people are dealing with, and all kinds of inflammatory issues. There's Alzheimer's, cardiovascular disease, diabetes, fibromyalgia, and all types of different myalgias, and there's unexplained neuropathies that are going on. There's weight loss and weight gain. So there's a lot of issues that are going on that we don't have a sense of what's really happening, except for the fact that we know that there are ways of dealing with this, and we know that there are ways of taking care of this. And what I want you all to know is I'm going to put before you some evidence that all of these issues are in fact connected to each other. So let's see. So if you graph the data points, the trend is unmistakable. Since the 1950s, rates of multiple sclerosis, Crohn's disease, type 1 diabetes have soared. And also that would be asthma and allergies. And there's similar spikes in hay fever and food allergies. There's also chemical sensitivities that have come along with that. And we know that infectious diseases, autoimmune disease, all sorts of different allergic kind of responses are on the rise, and that our immune systems have definitely been getting weaker. So what happens when you get a weakened immune system? Well, you get frequent recurrent infections. We have, let's see, hold on just a sec. All right, there we go. So we have frequent and recurrent infections, bronchitis, sinus infections, ear infections. We have meningitis, pneumonia, or skin infections. There's all kinds of inflammatory issues that are showing up, or infection of particular tissues or organs like sinusitis, UTIs, oral infections, skin disorders. There's also quite a few blood disorders and new ones that are showing up. There's low platelet count that's very common now, several types of anemia, and other more serious blood disorders like leukemia and lymphoma. There's digestive problems such as diarrhea, cramping, loss of appetite, nausea. And we mentioned before autoimmune diseases, and we're talking about multiple sclerosis, lupus, rheumatoid arthritis, the type 1 diabetes. There are hundreds of types of cancers. And there's also other conditions that are kind of unexplained, idiopathic type damage to different tissues, like to the heart and lungs and nervous system and digestive tract. And in children, a weakened immune system will also cause delayed growth or delayed development in the child. So it's clear that things have gotten much worse. But why are we getting sicker and sicker? That is the question. And we've known for a long time that our gut and immune health are closely linked. In fact, when I was in undergraduate school, we were told that about 37% of our immune system function had to do with gut function. But how it worked, we didn't really know. We knew that it was happening down there somewhere. And by the time I got to graduate school, that was a long time ago, it was already at about 50%. They're saying 50% is happening somewhere down in the GI tract, but we don't know exactly what's going on. And then what happened was everything changed. We now know that depending on which part of the immune system you're talking about, 70 to 85% of your immune tissue is located in and dependent upon your digestive tract. So since what's going on in your intestines has everything to do with your health, maybe we should be there looking for our answers. So to get you oriented, think about the fact that the inside of the intestines are constantly getting exposed to what's on the outside of your body. Because our intestines are inside our bodies, we don't always realize that it forms a protective barrier between our bloodstream and the external world. The gut has to deal with all the good and the bad in everything that you eat and drink. Therefore, it has to have a strong and intelligent immune system in place to ward off the attacks and prevent illness. So, so here's one of the important messages I have for you today. This is the first one, and that is the intestinal microbiome is now accepted as our newest endocrine organ. Now, the word microbiome refers to the flora inside your intestines, and that's bacteria and fungal or yeasty kind of bugs. There's all kinds of different things that live inside of our intestines. And in fact, it's not just in the intestines. There's flora that lives on every single surface of your body, inside your body and outside of your body. So we're going to call that the microbiome, but the majority of it is in the intestines. And the word endocrine refers to a place where hormones are produced. In the past, we thought of our body's endocrine system as primarily composed of glands. Each produces particular hormones that control specific functions in the body. You know, it causes the coordination of our body functions and the coordination of our brain, our mind. But now we know that the microbiome in your intestines produces a wide array of hormone-like chemicals. They're released into the bloodstream and act to direct the actions of almost all other endocrine glands. The major organs, it's controlling the organs, it's controlling all the major systems of your body. So think about the urological system, the cardiovascular system, the central nervous system, is all being controlled by the microbiome. The biochemical capacity of the microbiome is based on what species live in your gut and on the diversity of the species. So there's individual species that have an effect and there's diversity that has an effect. The concept of a diversity is not really that complicated. All it means is that the more there are, the merrier. Okay, or the more species living inside you, the healthier you will be. So here is an amazing review on important research that describes how the microbiome serves as our master endocrine organ. And although there are a number of individual probiotic species that have specific effects on our body, the majority of the hormone balance is derived from the diversity of the flora and from the overall health of the gastrointestinal environment. This publication is a fairly readable review of research, and it proves that the intestinal microbiome has direct control of multiple organs, glands, and organ systems. This control comes from its relatively newly discovered ability to produce and regulate multiple hormones or hormone-like compounds that come from the gut and reach the rest of the body through the blood, through the circulation. This slide should give you an overall look at what the microbiome of the intestines has control over. In addition to the local impact, the GI tract, in the GI tract itself and the enteric nervous system, and that's the enteric nervous system is the nervous system that lives in your gut. It has 1/10 of the nerves of your brain and spine. So that's a lot. It's like the second brain of the body. So we have the enteric nervous system and the gastrointestinal tract that are being controlled. And it's also critical for the control of our metabolism and the normal development of our immune system. It is directing the production of the hormones that control our metabolic rate, temperature control, energy levels, sexual function, our personalities, and so much more. For instance, did you know that there are species of probiotics that can cause you to lose weight without decreasing your food intake? We're going to be discussing more about how to regain our healthy weight in the third video of this series. By manipulating the microbes of the gastrointestinal tract, we can modulate blood levels of tryptophan as well. And that's an essential amino acid and precursor to serotonin. And that's the neurotransmitter that makes us happy. Using probiotics, we can adjust serotonin levels in both the enteric and the central nervous systems. So we're going to be discussing how to regain proper brain health in the fourth video of this series. And it's the diversity of the flora, or the number of species present, that overtly controls our major hormone system. And that's the HPA axis. Sometimes we look at it as the HPAT axis. That's the hypothalamus, pituitary, adrenals, and thyroid. So all of those organs are being controlled by the microbiome. And we're going to be covering hormone health in the second video of this series. So the take-home message here is that the hormone output of the gut microbiome is amazingly complex and vital for your health and well-being. And there's more. I may do a fifth video in the near future because there's strong evidence coming out that our blood pressure and our heart health is also being directly controlled or destroyed by our gut microbiome as well. So the gastrointestinal immune cells are known as Peyer's patches. These protect the mucous membranes of the small intestines against infection by releasing white blood cells, the T cells and the B cells. And there are certain species and strains of gut flora that prevent disease-causing pathogens from being absorbed into the blood by directly boosting the action of our immune cells. This is why it is so important to have sufficient colonies and a wide diversity of beneficial bacteria or good guys in the gut in order to maintain our good health. Who is living in your intestines can be determined easily by doing a comprehensive stool analysis. And what a comprehensive analysis is about is it's a kit that you get at home. It's a stool test. It comes with very simple instructions. And we can determine exactly who is living in your gut. We can measure the relative amounts of your good guys, and we can see if there's any bad guys there as well. So we can look for pathogens, we can look for the beneficial bacteria, we can see in how they are living in ratio with each other. We can also look at your digestive functions and see, are you digesting your food properly? Are there any issues there? Do you have any inflammation? Do you have any parasites? Are there any protozoa in the gut? We can now have a really good look at what is going on in the intestines, a very close look. So we can also, with the CSA, we can see what the let's see, give me just a second. We can see what pathogens are there and exactly how to treat them. So the results come back with medications and with natural components that will tell us exactly how to get rid of the pathogens in each person's system. And so that means that there's no mistakes being made, no medicine being given that won't work. So let's see. When the integrity of the gut is compromised, what happens is it can lead us to a leaky gut, which means that the body is no longer protected against invaders like undigested food, gluten, and bacteria which have passed through the little holes in the gut lining. A leaky gut gives rise to food intolerances, which can eventually lead to autoimmune conditions and other problems. A few examples of problems that have been shown caused by leaky gut are multiple sclerosis, Crohn's disease, eczema, arthritis, migraine headaches, psoriasis, depression, food allergies, multiple chemical sensitivities. But realize that leaky gut can be much more prevalent than we ever thought. It might be involved whenever the immune system has become weakened. So there's a gastroenterologist by the name of Donald Kirby, MD. He's a director of the Center of Human Nutrition at the Cleveland Clinic. And he's been quoted recently as saying, you know, from an MD's standpoint, the leaky gut is a very gray area. Physicians don't know enough about the gut, which is our biggest immune system organ. And he's right. Leaky gut syndrome isn't a diagnosis taught in medical school yet. Instead, to a classically trained healthcare provider, leaky gut really means you've got a diagnosis that still needs to be made. You need to hope that your physician is a good enough Sherlock Holmes and that they're avid readers of recent research to be able to help you out. But by the same token, I've always believed that a diagnosis is the last thing in the world that you'll need for a journey to getting well. Sometimes what happens is people get a diagnosis and they believe in that diagnosis. It becomes their belief system, and their movement towards health goes away. They don't believe they can be healthy. So in any case, the way do we get better is called the 4 R's. The 4 R's are remove, replace, reinoculate, and repair. Remove refers to taking away the bad things in the gut, taking away the bad bacteria, maybe any kind of toxins that might be there, food particles that we're allergic to, that sort of a thing. And we want to replace the good stuff that should be there. And what I'm thinking about here is nutrients and the enzymes that we need to digest food, and the proper pH to the intestines. We also need to reinoculate, adding back the probiotics that need to be there in the gut. And we also need to repair the damage that was done. So, I want to talk to you a little bit about alcohol liver disease, because when we drink alcohol, it leads to increased gut permeability. It can also lead to something called SIBO. SIBO is small intestinal bacterial overgrowth, and it can lead to dysbiosis, so just imbalance of bacteria in the gut. The leaky gut, after having alcohol, then increases the movement of microbes into the circulatory system, and also parts of microbes, breakdown products. And it not only brings it into the blood, it goes into the liver as well, via the portal tract. So it's coming in and kind of clogging the liver. And this instigates a long list of damaging responses to the liver, because the immune system in the liver is fighting off these particles that have come in there. And in fact, sometimes it's full of whole bacteria that have come on. So let's see. Give me just a second. Okay, so when we have all of these particles moving into the liver, we have immune responses from the liver and inflammation in the liver, and it causes an inflammatory liver disease. And this is called alcoholic liver disease. But it doesn't, as you can imagine, necessarily have to come from alcohol, but alcohol is a great way to get there. So the use of probiotics, prebiotics, or fecal microbiota transplants, and that means transplants from someone else's microbiota into the body, that actually can be very, very helpful in taking care of this problem. Let's see, I would like to be able to stop the sounds from people coming in, but that's okay. That will stop soon anyway. So the way that we shut down the inflammation in the liver is to calm the inflammation by putting in the correct bacteria and healing the gut. It's healing the leaky gut that takes care of this. And you can imagine that in order to heal a leaky gut, we can't be taking in alcohol. The liver has over 700 different jobs that it does very well when it's working well. But in an unhealthy person, you can imagine that if the liver is fighting off the effects of alcohol, what will happen is you're going to end up having a very toxic system, and it's going to land you in some other diagnosis. Everyone is aware, if you know it or not, of the hygiene hypothesis. It states that a lack of early childhood exposure to infectious agents, such as soil, microorganisms that live in the gut, and exposure to parasites, increases our susceptibility to allergic diseases and illness by suppressing the natural development of the immune system. So since about the mid-1980s, we have been taught to expose our children to the world and get their immune system strong rather than cleaning everything with disinfectant. So enter Dr. Graham Rook, an emeritus professor of medical microbiology at the University College of London. He says we know an awful lot now about why our immune system's regulation is not in terribly good shape. It's got absolutely nothing to do with hygiene. Today, epidemiological, experimental, and molecular evidence all support a very different hypothesis. Early exposure to a diverse range of friendly microbes, not infectious pathogens, is absolutely necessary to train a human immune system to react appropriately to disease-causing pathogens. Dr. Rook is explaining to us now in his TEDx and his writings that it's absolutely necessary to activate a variety of immune processes that regulate the immune system appropriately. Professor Rook likens the young immune system to a computer. It has software, but it needs data in the form of exposure to a diverse set of friendly microbes to train it to differentiate the friends from the foe and do so appropriately. So what's happened is that as we've gotten, we've changed our microbiome in the earth. We put out a lot of chemicals. It kills a lot of the good bacteria in the soil. We have irradiated food. We're not getting a lot of the bacteria from there. And what's happened is we have fewer of the friendly bacteria to learn from when we're young. And that lack of exposure causes our immune systems to grow up to be trigger happy. And this is the second piece that I really need you to understand. It's not just about the immune system learning what to attack, but learning what to tolerate. And the problem comes when our immune system meets up with something like an allergen, like peanuts or pollen. If it's not trained properly when we're young, it doesn't know that those substances are completely harmless. And so Dr. Rook's hypothesis is a nuanced message for us. We need to wash our hands, but not all the time. We need to use antibiotics when absolutely necessary, but otherwise don't use antibiotics. So let's see. The critical training of the immune system has to happen at birth. And for the first few years of life, it's also getting trained. And usually by passing through the birth canal of a healthy mom, newborn infants receive beneficial bacteria from the mother. And this gift of organisms immediately starts to multiply in the tiny GI tract of the baby and eventually acts to create and boost the child's immunity. The bifidobacteria are the dominant bacteria in the infant digestive tract. And bifidobacteria have been proven to protect our babies from rotaviruses, which cause diarrhea and oral thrush and cradle cap, and they protect newborn babies against many common infections. The bifidobacteria also help to prevent lactose intolerance. They increase the absorption of minerals and B vitamins and are essential to train the infant's immature immune system to react appropriately to the world. Again, breastfeeding is the best way to protect babies against childhood diseases because the milk of a healthy mom supplies a constant supply of live bifidobacteria directly to the infant's GI tract. That being said, I've encouraged new mothers to give certain probiotics to their babies, and I've seen miraculous turnarounds with even just one application in a young infant. As you can imagine, chronic immune system failure issues usually arise when babies are born by way of C-section and are not breastfed. So here's what we know so far. We know from research that C-sections have been linked to an increased risk of allergies and asthma, that owning a pet or growing up on a farm is protective against allergies or asthma. Antibiotic use, which kills off both the good and the bad microbes, especially use of antibiotics in youth, has been linked to asthma, cow's milk allergies, irritable bowel diseases, irritable bowel syndromes, and eczema and psoriasis. The Western diet lacks sufficient plant fiber and other diverse foods that nourish the most essential species of gut flora. So we know that without early training, our immune systems are set up to keep us increasingly inflamed. So for some individuals, the answer is a complete biofilm turnover. And we start that process with a comprehensive stool analysis, which I described before. And what we do is we start with that, and we see exactly who's living in the gut. And usually what I'm seeing in people that are suffering with these issues is they have a diminished population, or individual populations of their good bugs are diminished or gone completely. And we also get to see if there's an overgrowth of yeast, if there's overgrowth of other pathogens, biological pathogens, if there's any parasites or protozoa. We look to see if there's any bad guys that have set up shop. So then what we do is design a program to gently remove the bad guys, heal the intestines, attend to nutrition, and replace the proper intestinal bacteria. And that is the 4 R's that I mentioned earlier. So I can't tell you how often I get a call or an email from a client that says, oh, by the way, I had a really bad infection and my doctor gave me some good strong antibiotics. The infection is gone, but now I have. And so it puts my hair on end. Today, the powerful wide spectrum antibiotics have the ability to kill all of your bacteria and none of the yeast. But with fermented foods or probiotics taken with the antibiotics, or at least immediately afterwards, we should be able to regrow the microbiome, if we're lucky. It works some of the time, but the antibiotics leave the lumen or the space inside the intestines with a very basic or very high pH. And this high pH favors the regrowth of a whole raft of different kinds of yeast species and disease-causing pathogenic bacteria, but it does not favor the regrowth of our good guys. This problem can be made worse if a person is taking a proton pump inhibitor that blocks the production of stomach acid. So what happens then is the antibiotic therapy is throwing off the chemistry of the intestines. And the take-home message here is that antibiotic therapy is a perfect way to cause all kinds of havoc in the gut and seriously weaken the immune system. And we have to get really smart about this. We know that antibiotics, most of these that are on this chart, have been shown with great research that if they're given with a probiotic, they will work better, even if it's not a great probiotic. And if you're taking a great probiotic, it'll work even better. So, and the other thing I want to tell you is there are natural ways to kill infections in your body that do not require killing every single bacteria on every surface of your body. If you have interest in learning about how to do this, please email me directly through the office or my website. My website is www.wish4life.com. It's the number 4. If there's enough interest, I'm happy to put together a class on how to fight infections naturally. Let's see. So, oral health is another major issue and can be a cause of gut inflammation. This is one of many publications that I want you to take a look at. It shows us that orally derived bacteria can colonize and persist in the gut, leading to a hyperactivation of the intestinal immune system and chronic inflammation throughout the body that can lead to a host of other inflammatory issues such as cancer, diabetes, and especially cardiovascular disease. I've developed a quick and simple procedure that has worked for myself and many clients to clean up periodontal disease and to heal and reverse irritated or infected pockets in your mouth. If you have concerns about your oral health, all you have to do is contact this office and we can send that procedure to you. So this is the third and major point I want to bring you today. Many laboratories have demonstrated that the modern diet, which has an excess of simple carbohydrates and low fiber, changes the bacteria and other flora that live in our intestines. And the new unhealthy flora can produce certain lipopolysaccharides, or LPS, that act as endotoxins. They're toxic, and they break down the lining of the gut, increasing the chance of leaky gut syndrome, inflammatory bowel conditions, and food allergies, and all those other conditions I mentioned earlier. Once in the blood, these endotoxins have been shown to cause rising inflammation throughout the body and all the symptoms and diseases that come along with whole body inflammation. Endotoxins have been shown with research to be a direct cause for insulin resistance, which is also associated with obesity, cardiovascular disease, and can lead to type 2 diabetes. It was originally thought that endotoxins are released only after a bacterial cell dies. It's now known, like absolutely proven, that bacteria release small amounts of endotoxins as a part of their normal living, their normal metabolism. Although the majority of the toxins are still retained inside the live cells, still, many of us likely have leaky intestinal walls to some degree. Once bacterial cells are able to get inside the body, our white cells, our natural defense cells like the macrophages, the monocytes, they're going to recognize the bacteria as foreign. And although sometimes the bacteria can hide from detection, especially if the immune system has been weakened by poor nutrition, disease, or medications. You know, if your immunoglobulin A reserves are very low, then you're going to have less of an ability to attack. But usually what happens is the defense cells are going to recognize the bacteria as foreign and kill it. And the endotoxins inside the bacteria are then released into the circulation and exert their nasty effects on the body. Our defense cells can also release other substances which can stimulate pathways that make the negative effects of endotoxins even worse. So for example, the complement cascade, which is a normal part of our immune system, causes the release of histamine, which simultaneously causes the blood vessels to dilate and the whole body to become inflamed. The inflammatory response is mediated through the release of substances called cytokines and prostaglandins, and they produce pain. Interleukins, they usually give fever, and or tumor necrosis factor, which causes heat, swelling, redness, pain, and general loss of function. None of them are fun. And also, the coagulation pathway is affected by endotoxins. There's a general aggregation of platelets so we can produce blood clots. And not only that, the blood vessels become dilated and they become leaky. So the blood vessel walls, all of the vessels actually become leaky. So as you can imagine, this can easily be the cause of heart attacks and strokes, and may explain why our elderly population has a tendency to develop moderate to severe anemia as they age. So let's see. Here's a short list of the most common endotoxin producing bacteria. And I have to tell you that I get to see these in the comprehensive stool analyses that we do all the time. These are exactly the species that love to grow in the intestines when the pH gets too high, such as after treatment with antibiotics, or during any condition that causes inflammation in the intestines. And guess what? The research is pointing to these species as the source of most of the suffering and disease we see today. We're seeing a recognition that these bacteria are showing up prior to the major diseases that we are dealing with. So here, I just wanted to show you what a lipopolysaccharide endotoxin looks like. This is actually a structure. You can see that it sits inside the membrane of, and just a little tiny bits is pointed to the outside of the cell. So it's not until the bacterial cell breaks that you're going to see this. And these only exist in gram-negative bacteria. That list that I showed you before, these are all gram-negative. But know that endotoxins they're just made up of fat and sugar. They are a necessary component for those gram-negative bacteria to maintain their cell wall integrity and strength. So endotoxins are a major component of their cell walls and are necessary for their survival. Endotoxins are not all the same. They can be mildly toxic to severely toxic, and such as like a botulism. That would be a very, very severely toxic endotoxin, and there are many of them that barely touch us. They can add to local and body-wide inflammation. They can completely disrupt the immune system as well. And that being said, common endotoxins have been shown to cause damage to critical tissues, such as the central nervous system, peripheral nerves, muscles, and have been associated with damage to most of the major organs. So as you can imagine, it's absolutely crucial that we're able to measure when endotoxins are free in the bloodstream or are contaminating our foods or medicines. And so there's a huge push happening right now to develop new and highly sensitive testing to detect these endotoxins in many different types of samples. So this slide is giving you an early look at the diseases that have already been directly associated with endotoxins. However, now that we know enough to look for endotoxins, the list is getting longer every few days. Notice how diverse the diseases listed are. We now know that endotoxins are either causative or at least seriously involved with the onset of many autoimmune diseases, diseases causing chronic pain, and a long list of inflammatory diseases, such as cardiovascular disease, all three types of diabetes, and that's type 1 diabetes, which is autoimmune, type 2 diabetes, which is more a disease of inflammation, and type 3 diabetes, which is the other name for Alzheimer's disease. And that also is a disease of inflammation. And it's also associated with respiratory diseases, including asthma, as well as multiple types of myalgias and neuralgias. You know, that's pain in the muscles, pain in the nerves. It's also likely that endotoxins are the sole cause of Parkinson's disease. Let me show you. This publication is the first case report describing a persistent endotoxin-induced toxemia that's been going on for actually 13 years. This happened after a single accidental injection of only 10 micrograms of endotoxin from Salmonella into a healthy 22-year-old female. After the injection, she had severe sepsis-like symptoms, She had high fevers, chills, muscle pain, and flu-like symptoms. 21 days later, she began showing signs of Parkinson's disease. Her liver was able to take up much of the toxin, but it wasn't able to filter it all out of the blood. And the endotoxin has neither been successfully neutralized nor detoxified from this poor young woman. But her condition and the progression of her Parkinson's disease is being followed closely. So since this happened, Parkinson's disease has been associated with a number of different endotoxins, and we now have the early data to show us that, in fact, Parkinson's disease is a disease of endotoxin toxicity. And but this was the first case. I thought I would share it with you. So the answer, diet is the key. This is a publication I wanted to give you that demonstrates that a healthy, high-fiber diet is very effective in decreasing the circulating endotoxins. Here's another one. This publication lays out the importance of an overall healthy and high-fiber diet in tackling endotoxemia. But it's not just roughage that's needed. Many constituents of a healthy diet may contribute to the observed beneficial effects. For example, if you have an abundant intake of fiber, it may reduce the endotoxin exposure, not only for its ability to modify the diversity of the bacterial populations, but also through the production of something called short-chain fatty acids. These are fermentation end products. So when you're fermenting your fibers, you can create short-chain fatty acids, and these act to reduce gut permeability by organizing the tight junction assembly, which is basically healing leaky gut. Also, the microbiome producing the butyrate stimulates the expression of intestinal alkaline phosphatase, which is involved in the detoxification of bacterial endotoxins. So just by breaking down fiber, we can neutralize a lot of these toxins. In patients with type 2 diabetes, fiber supplementation exhibited a significant reduction in the LPS endotoxin concentrations compared to the control group. And also, consumption of fish as a part of a healthy diet decreases the amount of intestinal damage from endotoxins. So it's healing. And there's another piece in this. This is a really, really nice report here, and it talks about dietary calcium and how it appears to have a positive influence on what bacteria grows in the microbiome. So it helps to not only establish good diversity of the biome, but also a very healthy intestinal barrier. So these are some foods to focus on. This is just the basics of a great diet. We've got protein foods, we have vegetables, fruits in moderation, depending on what your needs are, healthy oils, low-fat dairy, and nuts and seeds. I pointed out goat and sheep dairy, and the reason for that is because I know that the goat and sheep dairy tends to maintain a better pH in your gut. It tends to promote better bacteria than cow dairy. But if you're dairy sensitive, that segment is completely out for you. And honestly, some people are allergic to some of the vegetables as well, and some can't do fruit, so know your body. Let's see. What we want to do is take a look at factors proven to lower gut immunity. You know, all of these factors that are listed here decrease our immunity, make us vulnerable to pathogens, which are, again, the bacteria, the fungus, or viruses that actually cause disease. In addition, there are many pathogens that are becoming resistant to antibiotics, which makes treatment of even the most common infections increasingly difficult. And the good news is that there are, as I mentioned before, natural solutions to keep our bodies strong and getting the right amount of all of the nutrients, the protein, carbohydrates, fats. But we also need the right amount of sleep. We need to reduce our stress. We need to practice meditation and prayer and get the hang of positive thinking. Get familiar with herbs that are safe and effective to kill off the disease-causing organisms. I would say the number one issue that I see is nutrient deficiency. That is where blood chemistry analysis is quite valuable, because once we know what is missing and the body then receives the nutrients that support a healthy gut and a healthy immune system, it's quite stunning how fast one's health can return. So we have all kinds of biological, let's see, we're on annotate here. We have all kinds of nutrients that have been shown to increase immunity, and there's no big surprise here. Clean, and that means no chemicals added. Nutrient-rich food. Fermented foods that have a wide spectrum of probiotic in it. And fiber. Prebiotics are a type of fiber, but the prebiotics that are right for you might not be right for the next person. Some people have bugs in their system, bad bugs, that like some of the prebiotics that are on the market, whereas other people don't. So some prebiotics might be good for one person, whereas others might be good for another. Probiotics. We're going to be talking in the next series about individual bacteria and what they can do for us as we go through this series. But the probiotics, I mean, even if you're taking just a very basic probiotic, it's better than taking none at all. Go after fermented foods, probiotics, or both. I do both. There are a number of antioxidants that are amazing for stimulating the immune system. And there are minerals that are absolutely necessary as well. We have all kinds of basic nutrients that can be taken that would help the gut, such as a good multivitamin. And sometimes extra B vitamins are needed. We have other concerns that can really be attended to through basic kinds of multivitamins, but your needs might be different than the next person. And sometimes it comes down to individualized nutritional supplementation to be able to get well. So what else can we do? We can eat right, have a healthy, balanced diet. We can help prevent infections this way. We can take in correct nutrition, practice good hygiene. Wash your hands after using the toilet and before eating. That makes sense. If I went into my mechanics the other day, and all the guys were having lunch with greasy hands. They had petroleum products on their hands. So I couldn't help myself. I had to talk to them. Take care of your teeth and your gums at least twice a day. Be physically active. Staying fit is important for your overall health, and it really makes a big difference. Get enough sleep. Manage your stress. It really deeply affects your microbiome. We know that these bacteria in our biome are actually talking to each other. I'm going to be talking to you more about that they actually send signals. And if we get stressed out, the signals increase. They're talking more. And the last thing I'll tell you is make awesome bowel movements. I want you to have, I mean, if you're 2 years old or older, we need 2 to 3 bowel movements a day, basically the number of meals that we have. That's what we need. And so how do you do that? Well, I have a gift for everyone that's come here today. And that is a little ebook that I'm preparing for you. It's called Simple Steps for Creating Healthy Bowel Movement. And so you'll have everything that you need to be able to create those wonderful bowel movements. All right, we have a question. Would I like to comment on helpful dietary changes or supplements for colitis? So we have a collagenous colitis in a 73-year-old female, and also dietary changes or supplements for eczema and frequent ear infections. Well, I'm going to tell you that the main issues that we have there is that we need to determine who is living in that person's body. That's the best way to go. Let's see what we have here. Can you see me? Yes, you can see me now. All right. So, what's the best thing to do? I strongly recommend doing a comprehensive stool analysis because then we know exactly who we're dealing with. And then we can determine, is a biofilm turnover needed? Or is this person going to be able to manage with what they have? It will also be determined, in a colitis, we're going to have a lot of inflammation there. In a 73-year-old woman, it's very likely that the immune system of the gut has completely shut down. It's very, very weakened. And so what's going to happen is we need to heal that gut. And so the question I would have is this person able to take in any soluble fiber? Like if you take zucchini squash and cook it down really well, can she digest that? Or is she down to just bread and meat? If there's no fiber in her diet whatsoever, then there's some basic healing of the gut. Sometimes glutamine is a good thing to do, but oftentimes we start with aloe vera and perhaps some deglycerinized licorice. We go after the herbs, the mucin-producing herbs. And I have a recipe for all these herbs that get added into coconut yogurt. And then the person, especially for any kind of ulceration in the esophagus or anything going on in the gut, we can take these herbs 2 or 3 times a day, and it's like putting salve and a Band-Aid on the intestines, and it gives them a chance to heal. So there's that. Let's see. Yes, I know, PJ. The endotoxin link to all the diseases is just amazing, and it's stunning, and it's changing how everybody's thinking about it. I have to tell you, I go to these GI meetings, the gastrointestinal health meetings, and we have, gastroenterologists that by Sunday afternoon, they're walking around like this, their hands on their head going, oh my God, I'm going back to work on Monday morning, and everything I'm doing is wrong. So it's very shocking. And I'm going to give you some more information in our next 2 segments that is going to knock your socks off on this. We're going to be looking very closely at what's going on and how to take care of it. Let's see. Okay, are there specific endotoxins linked to Alzheimer's? PJ, no, there aren't, not yet. But you have to understand this field is very, very new, and the tests even detect the endotoxins are still so young. We're just learning how to test for endotoxins in the blood, in the gut, in saliva. So we are looking at ways, different ways of testing. Do they come through in the urine? How do they come through? What endotoxins are being detoxed on what pathway? We don't know all the answers quite yet, but we're working on it, okay? The scientists are working very hard on this, and it's just amazing. Catherine, I love your question. She asks, what's the connection? What connection is there between the thyroid and gut dysbiosis? It's huge, and we are going to be going over that in our next video section, so if you can hold off, and we're going to be going over it in detail. But the connection in between gut dysbiosis and what happens with thyroid dysfunction is that is thyroid dysfunction. It's the majority of it. And caring for the thyroid means caring for the gut. So that's a spoiler alert right there, but it's going to be really, really good. We're going to be looking at that in particular. And best time, hi Shirley, best time and frequency to take new probiotics. Okay. Whenever you start a new probiotic, you always want to go slowly. And I know a lot of people were like jumping in. And what Shirley's referring to is probiotic Optiflora DI. It's a new probiotic. It's got a great delivery system. It's for really important major species. It's not going to give you the high diversity, but it will give you really great delivery. And I would say start with 1 a day. Honestly, it doesn't matter when you take it. You could take it with food. You can take it on an empty stomach. It's going to work. And but for some people, if they have extra special issues, they might want to take probiotic 2 or 3 times a day. there's such a thing to understand about probiotics, and that is we can talk about the dosing. Okay, so dosing can be more frequent or less frequent, and it depends on how much you're getting in your probiotic. But there are probiotics that are being put out now that are anywhere between 10 billion and 1 trillion cells per application. And it goes anything from maybe 1 or 2 species all the way up to 25 species. So there we go. Let's see. Barbara is asking. Okay, she wants to know why 2 different probiotic products were not put together into one. Why there's 2. Okay. And you're referring to Optiflora and Optiflora DI. The Optiflora is in that little pearl that makes it past your stomach. It's going deep into the intestines and driving some of that delivery into the colon. It's delivering further down. The DI is delivering in the small intestine. The Optiflora original also delivers to the small intestine, but later on in the small intestine, if that makes sense. So it's different areas that are being delivered to, okay? Does a person who's fighting Candida take ancient grains? Does this person need soluble fiber? Okay, everyone needs soluble fiber, absolutely. Can they handle soluble fiber is the next thing, because some people really have a hard time with fiber and they need to have they need to have, let's see, there we go. They need to have some source of fiber to be able to get things happening correctly in their gut. So do they need to have ancient grains? No, not necessarily. Ancient grains can, and that's Kylie that's asking that. The ancient grains protein that you're referring to, Kylie, is going to be okay. Let me see if I can find you here in my list of peoples and get you on here. I think I'd like to bring you on. There she is. Kylie, you're unmuted. And so all you have to do is click on the unmute and you can have a conversation with me. Let's see. And you may not be able to do that, and that's fine. So Kathy's asking me, do you have recommendations for building immunity in a 2-year-old? My friend's grandson eats well, was breastfed for 2 years, and is not in daycare, but picks up lots of illnesses. Okay, so what we want is, number 1, fiber in the diet. Number 2, probiotics. One of the advantages of the probiotics that come in capsules is you can actually open up the capsule. The capsule contents can be added into a soft food, which makes it super easy to get into a baby. And and also, I'm going to say this, even though the baby was breastfed, how was mom's health? Did she have a really, really good bifido population that she could use to be able to feed that child? If the child does not have a good bifido population, he or she might need some help. So anyway, I hope that helps. I would say a wide variety of food. One of the problems I see in children is no variety of food. In fact, years ago, I had a child sent to my office for nutritional counseling for both mother and son. The child was approximately, let's see, he was 3 years old and he was the size of a 1-year-old. He was deemed failure to thrive. And that child had 2 foods, and those were McDonald's French fries and soda, Coca-Cola. Those were his only 2 foods. There was no protein in his diet pretty much whatsoever. And you could probably guess this, but mother was obese. But the worst part of this is mother was an RN. She had training. there was no excuse. But the child demanded those foods only, and I explained to her that the child needs to be put in a room with other foods, no French fries, no soda, probably ever again for a long time, and eventually that child will eat. Just give a variety of foods, put on earmuffs, the child will eat. It's absolutely unacceptable for a child to not eat appropriate food. And you're welcome, PJ. Let me see. Okay, Anne's saying, I recently heard that one reason for candida overgrowth is heavy metal toxicity, and that candida can actually help keep you alive by absorbing the heavy metals. Is there any truth to this? All probiotics can absorb toxins. They absorb them. They're actually kind of short-lived. So they can absorb toxins and it goes out with the bowel movement. So having regular bowel movements is really important. That's why I made that gift for you. But so candida would not be an exception to this. There is, if a person is toxic with heavy metals, there will be heavy metals in candida. And candida, actually years ago, someone handed me a book. And it was all about how yeast loves to grow in the presence of heavy metals. And I thought, what hogwash? What organism would want to live in the presence of a chemical like that, a toxin? That would interfere with its own metabolism. That doesn't make any sense to me whatsoever. So I believe I threw the book away. Years later, I had a woman that I was working with that had candida from head to toe, under the breasts, under the arms, oral thrush, white tongue, vaginal nails. It was all over the place, okay? Really bad. And back then, we didn't have a lot of these, the knowledge of how to kill off a very severe infection like this. And so we used herbs, we used foods. She had already been through rounds and rounds of antifungals and they weren't working. So we were dealing with some other things. And I mean, she got to the point where she was asymptomatic, but only barely. If she looked at something sweet or if she looked at some ground grain, forget it. She would, I mean, just a little tiny snip and she would be symptomatic. So what happened was we were working on some kidney function issues. And I started to detox her. And son of a gun, she calls me up and she says, wow, this stuff is great for the candida. I can even have corn chips now and I don't break out, which is stunning if you think about it. That's just absolutely amazing. So I want you to know that it can be addressed. And but keeping the candida for a heavy metal detox is not a good idea. I hope that was clear. Let's see. Is the new Optiflora DI too strong for a baby or toddler? The answer is no, it is not. But I would break it open, put it into maybe break open. You can give small doses. Whenever we're using probiotic, like I said in the beginning, use just a little bit. So you can take a little bit, put it into maybe coconut yogurt or applesauce or something that's a soft food, a baby food, and mix it up. And then give a spoon, and then maybe later on give another spoon, and then maybe the next day, that sort of a thing. So you can dole it out and make sure that there's no gas or abdominal distension, because when you're changing flora, it can be a little rude in the beginning. So make sure you're being kind. Let's see. Okay. Anne is asking about electromagnetic frequencies. And, should people with immune or health issues be concerned about EMFs? That's a little bit off topic, kind of, sort of, because there's not really strong data yet to connect EMFs with immune system failure. But I can tell you that there are people that are very, very sensitive to EMFs. And I don't know exactly how that works, but I can tell you that I know if someone is weakened by electromagnetic frequency, then they should definitely avoid it. And you know what? I would say for everyone, test. and see if you're sensitive to electromagnetic frequencies. Shut off everything in the house. See how you feel. Set up timers so you shut off everything at night. See if you start sleeping better. That's the biggest one that I hear people say. It's like, wow, I shut off everything at night and I feel so much better. Let's see. So what I'm going to do is there are so many more questions, but we've really gone around the block with our question answer. I think I'm going to cut it off at that point. If you have more questions, don't hesitate to email the office. I'll do my best with them. And I hope that you can make it next time. We're going to be talking about optimized hormone balancing, and doing so with by optimizing our immune system health. Actually, I should do that better. We're going to be talking about natural solutions to hormone stability through optimizing intestinal health. So until next time, everyone, bye-bye.